Hello students, welcome to my YouTube channel. Today we are seeing enema and its types. Simple and easy notes by Miss Pooja, nursing tutor.
What is enema? An enema is a procedure of introducing liquid into the rectum or colon via the anus.
Definition: an enema is an introduction of fluid into the lower bowel through the rectum for the purpose of cleansing or to introduce medications or to nourishment.
Purposes of enema: to stimulate the defecation and to treat constipation, for example, simple evacuant enema. To soften hard fecal matter, example, oil enema. To administer medications, example, sedative enema. To protect and soothe the mucous membrane of intestine, an example, emollient enema.
To destroy intestinal parasites or worms, example, antihelminthic enema. To relieve gaseous distension, example, carminative enema. To administer fluid and nutrients, example, nutritive enema. To relieve inflammation, example, astringent enema. To induce peristalsis movement, example, purgative enema.
Continued. To stimulate a person in a shock and collapse in case of opioid poisoning, example, stimulant enema. To reduce the body temperature, example, cold enema or ice enema. To make the diagnosis, example, barium enema.
Classification of enema: mainly two types: evacuant enema, retained enema.
Evacuant enema. Simple evacuant enema, medicated evacuant enema. Cold enema. In medicated evacuant enema, oil enema. Purgative enema, astringent enema. Antihelminthic enema, carminative enema. In retained enema, stimulant enema, nutrient enema, emollient enema, sedative enema, anesthetic enema.
Types of evacuant enema. 1. Simple evacuant enema. Purposes: to stimulate defecation and to treat constipation. To stimulate uterine contraction and to ease the childbirth. Studies to clean the bowel prior to X-ray, sigmoidoscopy, visualization of bowels, surgery, and retention enema.
Continued. Solutions used: soap and water, 50 ml soap jelly plus 1 liter water. Normal saline. Tap water. Amount of solution to be used: adult, 500 to 1000 ml. Children, 250 to 500 ml. Infant, 250 or less.
2. Medicated enema. A. Oil enema. Purposes: to soften hard film matter. Given before first bowel movement after rectal or perineal surgeries to prevent straining and injury to the sutures and wounds. Solutions used in oil enema: olive oil, gingerly oil or sweet oil, castor oil and olive oil in 1:2 ratio.
Amount of solution used: 115 to 175 ml. Temperature of the solution: 100 degree Fahrenheit. B. Purgative enema. Purposes: these are given to cause the bowel to contract actively and to evacuate the contents. Solutions used in purgative enema: 1. Pure glycerin 15 to 30 ml. 2. Glycerin and water in 1:2 ratio. For example, if 30 ml glycerin, take double amount of water, that is 60 ml. 3. Glycerin and castor oil in 1:1 ratio, that is if 30 ml of glycerin, take equal amount of castor oil, that is 30 ml. 4. Magnesium sulfate, 60 to 120 ml with sufficient water. Amount and temperature of solution as same as that of oil enema. C. Carminative enema. Purposes: these are given to relieve gaseous distension of the abdomen by causing peristalsis and expulsion of flatus and feces. Solutions used in carminative enema: turpentine, 8 to 16 milliliters turpentine plus 600 to 1200 milliliters soap solution, milk and molasses, 90 to 230 milliliters of molasses mixed with equal quantity of warm milk.
D. Antihelminthic enema. Purposes: 1. Given to destroy and expel the worms from the intestine. 2. Before the giving this enema, the bowel should be cleansed by soap and water enema so that the drug may come in direct contact and the worms and lining of intestine. Solutions used: hypertonic saline solution, sodium chloride 60 milliliters plus 600 milliliters water. Amount of solution: 250 milliliters.
E. Astringent enema. Purposes: it contracts the tissue and blood vessels so that it prevents bleeding. Usually given in colitis. Solutions used: tannic acid 2 gram plus 600 ml water. Alum 30 gram plus 600 ml water. Temperature of solution is given as hot as the client can stand. 3. Cold enema. Purpose: given to decrease the body temperature in hyperpyrexia or high fever and heat stroke. Complications: hypothermia, abdominal cramps.
Retention enema. A. Stimulant enema. Purposes: given for the treatment of shock and collapse. Given in cases of poisoning, e.g., coffee enema given in opioid poisoning. Solutions used: 1 tablespoon coffee powder plus 300 ml of water. Brandy 12 ml plus 120 to 180 ml of glucose saline. Amount of solution: 180 to 240 ml. Temperature of solution: 108 to 110 degrees Fahrenheit. B. Sedative enema. Purposes: it is a retention enema containing a sedative drug given to induce sleep. Drugs used: paralleldehyde, potassium bromide. Dose: as ordered by the doctor. C. Emollient enema. Purposes: soften and lubricate hard fecal matter. It helps in relieving severe constipation. It contains oil-based solutions. Solutions used of 1 to 2 ml of starch plus 120 to 180 ml of rice water. Amount of solution: 120 to 180 ml. Temperature of solution: 100 to 105 degree Fahrenheit. D. Anesthetic enema. It is an enema containing anesthetic drug to produce anesthesia in patient. Drugs used: Avertin 150 to 300 mg per kg body weight. E. Nutrient enema. Purposes: it is retention enema to supply food and fluids to the body. It is particularly useful in conditions like hemophilia, which make IV infusion difficult. Solutions used: normal saline, glucose or dextrose 5%. Amount of solution used: 1,100 to 1,700 milliliters in 24 hours or 180 to 270 milliliters at 4-hour interval. Temperature of solutions: 100 degrees Fahrenheit, 37.8 degrees Celsius. Thank you for watching my video. To get more easy and simplified notes, subscribe to this channel and click on bell icon to get notifications.